The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering bioidentical hormone replacement therapy. With us, we have an expert on the topic, Dr. Stoller. Dr. Stoller, welcome to the program.
Thank you, Randy.
All right, now, before we get into today's topic, and I know you've been doing this for quite some time, but tell me about your practice. I mean, who is the typical patient nowadays that comes in for bioidentical hormone replacement?
The majority are ladies whom are maybe preparing to go into their menopause in it or even through it, whom have lost the vitality of their lives.
Okay.
They're feeling tired, depressed, may not have the response with lovemaking with their significant other, and just a menagerie of things that are happening. Depressed, skin is changing, emotions are changing, hate their husbands at times.
All right. Okay.
And at our point, I remember some of those days in our own marriage. And so these are the people we're seeing typically. And when they get better, guess what? They bring their husbands.
Is that right?
It's exactly right.
So you've been doing this. We should mention this. And I met you, by the way, at an anti-aging conference where they had hundreds of doctors sharing ideas.
Exactly.
And you're one of the guys that have really been doing this, a lot longer than most.
Yes.
Tell me about that.
Well, I attended I didn't go to learn this. It just happened that at Vanderbilt University, I went to a big conference, and the guy that was the chairman of the reproductive endocrinology department, Joel Hargrove, lectured on what that time was called a micronized estrogen and progesterone, which was bioidentical.
Okay.
And I saw the benefit, and as he lectured, it just shocked me at what I've been doing with the women I was giving horse estrogen to and synthetic, not progesterone, but progestin. I promptly went home and took quite a few hundred women off of that and changed them, and the results were, as you would expect, very positive.
Was it a big difference immediately?
Yes, very definitely.
So putting them on natural hormones?
Yes.
And that was since about what time? By like 1987 you've been doing this?
87, yes. The technology's changed. At that time we were using blood tests to monitor this thing, and I've been monitoring it for years.
What's wrong with the blood?
Well, you tend to get falsely low values. And one of the things we've learned is that you don't treat numbers, you treat a patient.
Okay.
So had we have treated...
What does that mean, by the way? What does that mean?
You treat them until they feel better.
Okay, good
and
point. All right.
So, by doing the blood tests, when I retrained, I have some of those people coming back, and they're all overdosed because they went to physicians whom didn't have a clue as to what to do, so they continued what I was doing, and I'd been over-treating them. So we've reduced the dose.
So you do it with what? You do the testing you do, saliva, urine?
Yes. 24-hour urine collection.
And you get more accurate
yes. And
view of the hormones that are,
yes.
Active?
Yes, and I like the 24-hour urine because I get the metabolic breakdown products, which helps me to monitor this. It also helps me to monitor the 2, 4, and 16 hydroxy estrogen, and you want to keep that in balance because if you get it out of balance, you can create as much trouble as you're helping.
Okay.
So you need to watch it.
You say you're changing people's lives, women's lives.
Dramatically.
How so? Give me an example of somebody that comes to you, maybe they're a mess, you do bioidentical hormones, nutrition, etc., and now they feel great. I mean, tell me about that.
Yeah, some of them have written me an email, testimonial, and we've published them on the website. They've given me permission.
Okay.
And, they come in with, maybe they're having crying jags, they can't sleep, they're gaining weight, they feel tired, their fingernails are not right, and, it just goes on and on and on. And what will happen, and it doesn't happen overnight. We have people feeling a lot better in 2-3 months, but it may take a little longer. But we're making them happy again. They're having a wonderful relationship with their husband. But you know what happens? They end up bringing the husband in too.
So the sex drive comes back.
Oh, very definitely. And
what about memory, things like that?
Oh, it improves.
Okay.
And they're resting, and so if they're going to bed in 7-8 hours at night, they're getting up rested, which they would not do, and they don't have to take mid-afternoon naps. And we just remake them. We give them their life back. We give